And also next one is coming to the mouth, how the mouth is going to be changed during the fever. So different type of the mouth also is gives the clues. So what type of conditions? For examples, this just now we according to our last in the discussions, they may chance to get the hepatitis loss. So anorexia they're going to feel. So because of hepatitis going to loss in most fevers and also intake of the food and fluids come down. So the mouth become dry and also coated. If you eat and drink everything, so those people won't get the like any coating or any on the tongue. So if you see from morning to evening, so we are walking, we are going to have food and have drink something. So if you check, you won't get any like any coat, any like this material we cannot observe in the during the daytime. If you wake up in the morning, you can observe so before brushing, you can feel the some coating on the tongue. So what if you are not taking the food? So the bacteria and also virus is going to be, so whatever the material is going to be, what we had also is going to be like a deposit on the mouth. So on the tongue. So this is most commonly seen in case of who already having the hepatitis loss or if they are not taking the food properly. So this is the presence of the dried up the debris over the teeth or at the level of the lips margin is called as episodes. So it's commonly seen in who already like a loss of appetite or if they're not food, the tongue become dry and mouth is going to get the dry. So it may use the debris formation on the tongue. And also the pattern of the coating of the tongue may be characteristics. So in typhoid fever, the tongue shows the central coating. So in the central coating, we are going to found only centrally here. So that means the surrounding you can found here, the surrounding is going to be the periphery is there is no coating, but if it is originally there in the center, it indicates the typhoid fever. In many cases, tongue may shows the other changes, not only in the typhoid, in many others like a high fever. So these tongue coats are going to be altered. So in the typhoid, is the center is going to be the degree formation and periphery is going to be the clear. So this type of more common symptoms associated with the typhoid fever. High fever, continuous fever, and also the rashes as well as this tongue is going to be coated with the debris. So these are going to give the clues. And along with if you have the diagnosis like investigation process like a blood analysis, so we can found that typhoid like a virus salmonum type. So this one is going to be so we can found in the like investigation we can diagnose clearly in the we can like a enteric fever also called as typhoid fever. And also soreness of the tongues we can found in the measles. So if you see here, so it's going to be this like a source. It's going to be rashes, like appearance. It's because the blisters are going to be like the eruption it may chance to get. So these conditions may found in the measles. So and also is coplic spots and also like a rashes and this type of symptoms commonly seen in the measles. And next one is the red beefy tongue. So it's because of the in case of side effect of the broad spectrum of the antibiotic therapy. If anybody use the antibiotic for a long time, so they may chance to get the tongue becomes a like a red appearance and also beefy tongue. So how they are like a very thick as well as is going to red appearance. So this is the side effects for the broad spectrum antibiotic therapy. So coming to the other complications in case of like in the different conditions, the tongue is going to appears in the different shape, different appearance. So the white curdy membranous over the tongue is easily removable. So and also this is due to candidiasis due to prolonged broad spectrum of the antibiotics. So because of the prolonged use of the antibiotics also, they may chance to get this white mucus and also this is coated with like a debris over the tongue. So in case of the like a prolonged duration of using of the antibiotics, corticosteroid, and also immune suppressor states. So just recently, according to like a surveys, because of the pandemic situation, many patients use the corticosteroids to control the infections. So after using the prolonged usage of the corticosteroids and antibiotics, so many people complained after the this COVID-19 like a subside, like if they're it means they control the symptoms. After recovery also, many people complained about this type of symptoms because of the prolonged use of the corticosteroids and also antibiotics. If the immune suppressed states, the immune less, so they may chance to get the debris formation, the white mucus formation on the tongues. And also is going to be ulceration over the tongue and also bleeding. So they are going to get the bleeding and also ulcer and also wound-like appearance. So it's going to be found in the Stevens-Johnson syndrome. So in most common, so they are going to do the bleeding as well as the tongue is becomes coated and also ulcerations may form. And also in case of HIV and also the immunosuppressions, if anybody have like a immune deficiency, so they may chance to get the tongue is going to get like a thrush, like a fungal infection. How they're going to in the fungal infection, how they feel, the same things are going to be observed in case of like a HIV patients and also immunocompromised patients or immunosuppression patients.